Stop going into healthcare if you cannot show compassion for all people.
Whatever you're doing right now, I need you to stop and watch this video.
Fuck! When's your due date? Right now. Is your due date 11? What? How many times have you been pregnant? 3. This is your 3rd pregnancy? Yes! You have 2 babies at home? It's in my ass! You have 2 babies at home? Who's your doctor?
Lang is her doctor. Y'all treat all your patients like this or just the black ones?
Beverly, this is the first time I have a patient for you. Alright, last name is Jones. She's G3P2. I'm not sure when her due date is.
Her due date is
just
the
said
10th.
it was the 10th. I think her due date is the 10th.
She got 3 pregnancies, 2 babies at home. I bet y'all listen next time. When you found out you was delivering at this hospital, your ass should have changed doctors.
Now, see, this is exactly the shit that makes me say bullying needs to make a comeback. Because clearly embarrassment is the only thing that makes people do their fucking job. Let me say this loud for the people in the back. Stop going into healthcare if you cannot show compassion for all people. If you haven't seen the video of the woman in active labor who sat in the waiting room for 30 minutes before even going into intake at the Dallas Regional Medical Center in Texas, which is extremely confusing because they offer labor and delivery at the hospital, and they say on their websites they pride themselves in compassion and comfortable care for mothers. But is the compassion in the fucking room with us? Now, if you've ever given birth and you know that pressure you feel in your ass, that's the body's final warning. And the lack of urgency in the fucking room was loud. Surely they should know that this could be extremely dangerous. Delaying care like that puts both the baby and the mother in extreme risk. Loss of oxygen, emergency delivery, hemorrhaging, fetal distress. This isn't a small mistake. This is a mistake that can cost a life. Pure negligence. And if this is how they treat women on camera, imagine the shit that they're doing when they're not getting caught.
Tell me why I saw a black mother about to give birth not in the delivery room, but in the damn waiting area waiting for a nurse to sort through the damn documents. This black mother came in clearly in active labor, like full contractions, barely standing, and instead of rushing her to a delivery room, the nurses told her to sit in the waiting area. The waiting area. I couldn't believe it. This woman was crying out, gripping the chair, literally screaming in pain, and the nurses were just ignoring her, acting like her suffering was background noise. They were chatting, sorting paperwork, moving at the slowest pace imaginable, while this poor woman was basically about to give birth right there on the floor. She sat there for over 30 minutes. 30 minutes. And then, get this, they finally take her back, and her baby is born 12 minutes later. And I'm telling you right now, if she hadn't been a black woman, they would have rushed her straight back without a second thought. What I saw was neglect. It was disrespect. It was absolutely racist.
Hi! Did you all see the video of that young black woman literally giving birth in a wheelchair inside of a hospital because the nurse next to her just didn't care? This woman is screaming in pain, clearly in distress, and this nurse is asking her benign questions that could clearly be answered bedside or, I don't know, at a different time. This nurse showed zero care, zero aptitude for nurture, and she should be held accountable. This is what systemic racism looks like, because this is putting a black mother in danger because someone decided they couldn't be bothered. They're not in a hurry today. I'm sorry, but if you cannot recognize pain in a human being because she's black, you have no business being in healthcare. No business being anywhere near a labor and delivery floor. You should be reassigned to shelving books in alphabetical order in the hospital library, bitch. Black moms deserve better. Black families deserve better. Black pain is real. And if that sentence bothers you or surprises you, you have no business in healthcare.
You don't have to be an OBGYN. You don't have to have any medical knowledge to know that this woman is in distress.
Is your due date 11?
For those primal screams not to invoke an ounce of humanity. Think about that.
What? How many times have you been pregnant?
Seriously, who gives a fuck? A baby's coming.
Brief! This is your third pregnancy? Yes! You have 2 babies
It's in my ass!
Third baby, it's in my ass, means she's gonna have a baby on the floor unless she gets that woman to a room now.
You have 2 babies at home? Who's your doctor?
Lang is her doctor.
Let's talk about this Dallas video because it's not just bad behavior, it's dangerous, it's discriminatory, and it's why black women in this country keep dying. The young woman's in active labor, and clinically we all know that priorities shift. Intake stops, and your eyes should be on that mom and the baby. But instead, we're watching a nurse sit there asking frivolous questions while a black woman is clearly in distress, progressing, and not treated with the urgency and dignity that she deserves. It's not just rude, it's dangerous. It's egregious, and it's actually disgusting medical care. And I need y'all to understand something, that as a black OBGYN, this is not an isolated incident. This is a culture. And this is what happens when a healthcare system that is not designed for anyone outside the majority, this is how it affects and shapes the legacy and how black women are treated in real time. This is our maternal mortality numbers. This is how black women end up ignored, undiagnosed, untreated, and unprotected. It's a bias, it's systematic, and it's behavior like this that gets passed down, normalized, excused. This is a culture problem in Dallas, Texas probably as a whole. And a culture doesn't change with a press release. It changes with accountability, retraining, leadership, consequences, and a refusal to let people like this touch patients. So, in closing, black women deserve urgency, compassion, and clinical excellence. This ain't it. What we saw was unacceptable, and it's time that the healthcare system finally stops pretending that this doesn't happen.
The video I just watched is absolutely horrifying. There is footage circulating on social media right now of a young black pregnant mother in active labor arriving to an emergency department, and instead of receiving urgent, compassionate care, the triage nurse appears to be more focused on completing paperwork than focusing on the human life right in front of her. It appears she doesn't visibly check her, no fetal monitoring, no stabilization, instead forms in a mother that is in active labor. This is a medical emergency, and in that moment, she appears to be completely ignored. No empathy, no humanity, just cold, and that is completely unacceptable. My heart goes out to that mother. I hope with all my being that she and her baby are okay, because we as healthcare workers, we should be the ones that embody light, hope, compassion, humanity. But in this case, all of that was missing. And here's the hard truth. This is not an isolated incident. Black women in the United States are 3 times more likely to die from pregnancy-related causes than white women. 3 times. If you saw that video, and if what you witnessed is an obvious display of discrimination, and you felt your blood boil, you are not alone, because I am fired up too. Because this is entirely preventable. And as caregivers and as healers, we must demand better from ourselves and from our system. And to that young mother, I truly hope you're okay. I hope someone stepped in. I hope you were heard, and I hope you were seen. To my fellow healthcare workers, we need to do better. We must show up. We must listen. We must take action, because every mother deserves dignity. Every baby deserves life. And every patient deserves humanity.
What we see in this video is a black woman who is actively pushing her baby out. Anyone who supports childbirth knows that those are pushy, grunting sounds she is making. She's about to have her baby. The clinician is looking at the screen, following protocol, not actually paying attention to the emotional needs of the mother. We know that black women are more likely to die during childbirth, more likely to be dismissed and not be listened to. And this is what we're seeing in this video.
During our births, we need to be held and listened to. And this is especially important for black women who so often experience this form of neglect.
The healthcare system is not set up for black women. And I'm saying this as someone who experienced this firsthand at St. Francis Hospital in Hartford, Connecticut on November the 1st of 2024. I just literally watched a video of a lady in labor. She's in active labor. She has her contractions. They're coming in, and the nurse is just concerned about asking her date of birth, how many children she have, instead of getting her comfortable and actually listening to her and watching her body language. She's sitting there asking her all these questions, causing her more distress. It's ridiculous how they treat us, and I'm saying that because of someone who has experienced this. But something has to give. Something has to give. She's an active labor.
This message is to that nurse who had that motherfucking girl suffering in Houston, Texas, like her motherfucking baby was on a back order. Mama, what you was doing? Cause the damn sure was a nursing, Miss RN. Baby, that girl was fucking trusting you to step in. And you failed. You failed her, Miss Clifford, the big red dog. Baby, you gotta do better. As a woman, cause I'm not a woman, you're a woman. So for you to help another woman, you fail. And for a woman to bring another baby into this world, you failed her. And I'm so upset with you. I'm surprised because no woman should have to wait that long to fight while she bringing a baby into this world. I'm disappointed with you. I am upset with you because I'm so upset. That woman was waiting for you to step in to help her, and you failed her. I hope you get fired. And I hate to say that because you probably have a family, but in this situation, you didn't act like you had one. You failed her. And this is my thing. If you ain't feel like fucking working, you should have stayed the fuck home. How the fuck you clock in for healthcare and stand there like a fucking background extra? Baby, nobody told your ass to stand there as a motherfucking nurse detective. Then bitch, you start playing motherfucking slow as my motherfucking Wi-Fi. Cause what the fuck you did was embarrassing. Do something else or do motherfucking better.
It's normal for them to get the paperwork and get all of your, history and stuff in the computer. What's not normal is the demeanor and the attitude that the nurse had towards her. There was no type of comforting words. There was no acknowledgement. I'm more disgusted by the behavior of the nurse, not the whole intake process. What pisses me off is that she's clearly in a lot of pain. She's in discomfort. Things could have been handled differently. If you're going into the hospital like that, you're screaming in pain, they need to be handling it differently. And no one else was in that room doing anything. That nurse was sitting there calling doctor's offices or whatever, but there was no sense of urgency. And I'm sorry, but giving birth is like life and death, okay? Unfortunately, I know of a mom who got septic and passed away right after she gave birth. I think we forget that even though you're in a hospital setting, it is still extremely dangerous and things can go wrong. There should have been some kind of sense of urgency, empathy, sympathy, something from the nurse. I don't care that we're overworked or whatever. That doesn't mean that you deserve bad care.
I really don't know what to call this. In 2025, in 21st century, people are still facing such extreme racism even in the hospital. This is really sad. You can all see that the mother was really, really in pain, and the nurse was just reluctant. She could have at least done something, taken her to the maternity ward so that she can ask all those questions she's asking her while she's at bed rest. She just gave birth after 12 minutes. That shows that the mother was really, really bad, and this is so hurtful as a woman to watch. And it should not be happening in this 21st century. Racism is still high, and the one thing I know, if the patient was white, it would have been a different case. But because she's black, that's why she's facing all this. Let me know what you think about this nurse. Like the video, share the video to your friends, and credit belongs to the creators of these short videos. Thank you for watching.